60 seconds, guess the diagnosis, and as always, answer at the end. Let's go. Monica is 32 years old. She's normally very fit and well, but has been complaining of right upper tummy pain for the last 6 months. She initially started having cramping sensation. This got progressively worse and now affects her a couple of times a week. She's been tested before with a urine test, which was negative for infection, a pregnancy test, which too was negative, and the blood tests were normal. Over the last 2 weeks or so, the pain has been so excruciating. It's particularly worse towards the evening, and sometimes she falls asleep and at 3 in the morning is woke up by this significant right upper tummy pain. She's tried to modify her diet but is really struggling to notice a difference. Over the last 24 to 48 hours, the pain has become unbearable. She comes into A&E to see you. She's holding the right upper pain. She's needing in the arm pain relief, which starts to touch the discomfort. When you're pressing on her tummy, she's exquisitely painful around the right upper part. When you press down and ask her to breathe, she all of a sudden gasps. You notice that when she's breathing in, the lungs are inflating. This is pushing the liver down, and then the liver is all of a sudden hitting your hand, and that's what's causing the pain. Routine blood tests show that the liver function tests are abnormal, the bilirubin is slightly raised, and the infection markers are starting to climb. You notice in the first 12 hours she starts to spike a temperature, becomes feverish and unwell. If I tell you this is due to a blockage, the liver makes bile. This is almost like fairy liquid or detergent. It's vital to break down the proteins. Just like an oily dish, water is not enough to clean it. Sometimes you need a detergent to break the fats down. This is the role of bile. Made in the liver, it is then pushed down the hepatic tube or duct into the gallbladder. The gallbladder is a smaller sac that stores the bile. This is important because the bile isn't needed all the time. It's only needed when you eat. When food is detected in the stomach, the gallbladder realizes the bile's needed. That's when it squeezes and the bile is sent out of the cystic duct down the common bile duct to meet the food. Here, the food is almost broken down, pre-digested for the bowels to then take away the nutrients. If I tell you an ultrasound has found some gallstones in the gallbladder, when the patient's eating, the gallbladder is squeezing to get rid of the bile, but the gallstones which are stuck or blocking the bile duct are reducing the outflow. It's like putting your foot in a hose pipe. There's increased pressure on the tap. The stone is causing a blockage, which is leading to back pressure and damage towards the liver enzymes, leading to the abnormal results. In addition to this is a lovely place now, because of the lack of flow, for bacteria to grow, and the patient is diagnosed with cholangitis or infection of this system. The question in this case is when the ultrasound and then MRI scan is done, a very rare finding is noted. A stone is found either at the top of the gallbladder or in the gallbladder tube. Its pressure is then pushing up against the common bile duct, rather than a stone actually being in the common bile duct. This is quite a rare presentation, and the patient looks at you and says, "Doc, what do you think's going on?" Correct, this is Meretzi's syndrome.